Jessica DeMassa with WTF Health. I'm here at the Barcelona Health Hub, and joining me right now, I have two innovation guys from Yale New Haven Health System. I've got Peter and Arnold, the Chief Innovation and Transformation Officer and Chief Population Health Officer, right?
That's correct.
All right, very good, guys. So we are going to pick your brain about all things innovation when it comes to health systems, because this is kind of like a little black box when it comes to the startup world. So what do you think some of the challenges are that most startups don't recognize when they're trying to push an innovative solution into a health system? And I'm saying push on purpose.
Yeah, no. So you want me? So I'm going to take a step back. So I'm still a practicing surgeon, and over the last 20 years or so, both at UCLA and at Yale, I've been interested in trying to understand how we can get innovation into the health system. You would think that it's easy, but it's not as easy as one would think. There was a survey, and we just presented this recently, that the New England Journal of Medicine Catalyst 2017 surveyed healthcare providers and administrators as to where's the need in healthcare for disruption. And the two highest was in the hospital and health IT. So as I tell everyone, that's a good news and bad news. The good news is there's an opportunity for us to have impact with disruption with regard to innovation for health IT and the hospital. The bad news is it hasn't occurred yet. So it's one of the last sectors to get in. And I think the barriers to that are several-fold. One, I think there's a misalignment with respect to risk. So innovation requires risk. And if you look at innovators are great at pivoting. They fail fast, and so they're not afraid of risk. If you look at health, you look at hospitals, hospital administrators, physicians, providers, I think we're the exact opposite. We don't want to fail. We've never failed before. We don't find it comfortable. So our risk assessment, the risk that we're willing to take is a very low number. And so I think that's one misalignment. The other is understanding, so that's understanding our world. I think, and I'm blanking on number 2 and 3, and I'll think of it in just a minute. No, hang on.
All right, we'll save you from that. So think about 2 and 3. So I'm going to ask you to weigh in so population health. You're taking a look at this, and everybody is talking about AI and using AI and the medical record and trying to discern all of these big trends and figure out how to improve population health. What's your take on that? I can hang on.
Yeah, so a couple of things. Number one, I think that there's a huge paradigm shift in the delivery of healthcare in 2 areas. Number one, healthcare is moving to the outpatient. Number 2, we are not focused on the sick. We are focusing on keeping people well. So the proactive population health is really important, doing all the prevention, identifying chronic diseases ahead of time, intervening in the chronic disease, and at the same time, making sure when they're sick, they get care at the right place at the right time. The problem becomes access. We have a shortage of doctors, and we also have clinicians doing a lot of things that technology can do. We believe that technology could do a good component of what we do in the outpatient world. For example, patients could be directed to get the proper care or the right care, the right place at the right time. If it's something not so serious, they could be directed to telehealth, which doesn't require a high level of care. If it's something that's not so critical, they could be seen in an office by an APRN or by a physician. If it's critical, they can be directed to the emergency room. Right now, it's a free fall. Patients go for simple things and clog up the ED. Mm-hmm. Patients go to walk-in centers where they have no records. So we also have outlets, all kinds, because they see the need. So we have retail clinics, we have pharmacy opening up 5-minute clinics. They are staffed with folks with very little experience. At the same time, the difference is, for example, when we in the health system provide telehealth, we have the same standard for all delivery that we have within the system. We also, if you came and had a video conference with me on your health, I have your medical record. I know all about you. I'm not sort of stabbing in the dark. So there's enhanced safety and quality. So that's the huge difference, why we need technology to be able to do some of the pre-work and let the physicians and the nurses practice at the highest level of their license.
So I want to unpack this a little bit, because I think that both of you guys have given us some good food for thought right off the bat here in terms of, the digital health and the health technology ecosystem and how they keep trying to work with hospital systems. You're the dream client for so many startups. And I think from what I'm picking up that you're saying is that there's just this misunderstanding of what the organizational priorities are. You're talking about having, continuity of care by having access to the medical record all along. You're talking about standards and on risk mitigation and making sure that there's a quality aspect to care that you would, in parity almost with the hospital if it were a telehealth consult. And then to your point earlier, I mean, you're talking about, just not engaging the clinician in terms of being able to integrate the solutions better into the health system. So what's your advice, I guess, for these startup companies who want to work with the health system, even just to pilot their solution? What's the right way to go about this? Because I think everybody, there's kind of like that tension. I talk to a lot of physicians, and there's a lot of angst about having another EMR situation where this whole system is developed and the clinicians are left out of it, and then they're forced to deal with the aftermath of it. And then now you're seeing things like burnout and people not going into medicine, or people who are in medicine who just can't stand their jobs. So how do we make sure that with this next big push of technology, the digital therapeutics, the digital health tech, how do we make sure that clinicians are engaged, number one, and then number two, it's not the same kind of situation where we end up off-putting the medical community by the way we integrate the technology in? What do you guys think?
So I'm going back to 2 and 3 now. But so the answer is, one, as I mentioned, misalignment of risk. So you have 2 different populations who approach problems differently. So that's a non-starter right there. 2 is workflow. So I think, and I've seen this even here in Barcelona, when the innovators have an idea, the idea is valid in principle, but they don't think about how it's going to be incorporated into the workflow of the physician. Perfect example, I think, is the electronic medical record. And as you've already pointed out, it's created a lot of burnout. Physicians now, you tell them technology, they think of EMR, they think of what I have to do. You've just now made my day go from ending at 5 p.m. to ending at 11 p.m., or I'm spending the weekends catching up, because we don't think about how the technology is going to be used in their workflow. We, physicians and providers, are a little stubborn, so we like to do what we do and how we do it. What the innovators have to understand is it may not make sense, but you have to figure out how your technology can work within that workflow. And then the third, and you've already mentioned this, is pilots. So how do you test? And I think we failed on pilots for several reasons. So people talk about pilots being the death of innovation. And I think there are a couple points that can be made there. One is you need champions, and we've failed too. We've brought in devices and technology to Yale New Haven Health System. If you don't have champions, you don't have people who are thinking about it on a daily basis, both on the IT side and on the physician, provider, clinical side, that's a failure. And it's not just 20% of one's time, it's all the time. And so you need the champion to be there, to be working. You need to think about the trajectory of the pilot. Is the pilot for how long? What's the next step after the pilot? And then if you're going to scale, how are you going to scale? So pilots are one of the issues with respect that I don't think we think about them properly and how we actually test the technology. But I think at the end of the day, we have to listen to each other a little bit. We don't have people that bridge our 2 worlds. There's a chasm. The innovator they're entrepreneurial, they're innovative, they're looking for solutions. They have to better understand the world of the physician and the provider. What's the workflow? And we talk about push-pull. So we don't want technological push, we want technological pull. We want to give you the solution, and then you pull or provide for us the technology that's going to lead us out of that. And we as providers have a responsibility and an obligation to listen to the innovators, understand their world. Their world is different than ours. They do things like pivot. They constantly look at regulatory issues that we don't think about, business issues, technical issues. So they're thinking about things that we actually don't understand why they have to think about those. So there has to be better communication and understanding of each other's world. And then I think if we have that complementary understanding, then we can have a greater impact. There's no doubt we have to do this. But if you look historically, look at the robot, for instance, it's taken a while. It's now an accepted standard, people know, but it's taken a long time. And we also have to realize, and I think people have to stress the fact that we still need providers in this world, that technology is just going to augment, it's not going to replace. And so that's the other thing. There's a threat that people feel, I think providers feel, and it's not the case. If you look at technology and what's been done thus far, it actually has augmented our ability to care for other patients. And so I think we have to level set. Everyone has to understand what's the expectation, where are we going?
Yeah, I think just want to add to that, and I think this is a good example that you alluded to about the EMR. Some of the best EMRs were developed by some really smart people, and they have some great functions. We use one of them. The problem is that it's just the user is the one having trouble with it. And that component probably did not have enough input. So I think this is a lesson we learned. So for example, now we look at something and we say, okay, fine. one of the big questions is that we've learned from our experience with the EMR that the physicians are extremely upset about it. And I think somebody else made the point, to the point that they're reluctant to try any other innovation and technology that may actually enhance their life. Even if we tell them this is going to improve your life, they don't believe it anymore because they've been led down a path. The EHR we use is extremely good in reporting and finding and so on. The problem becomes is that it's just very click heavy. Yeah. And it's distracting, and I think most of us physicians who are used to having eye contact actually dislike the screen contact, and the patients dislike the fact that we have so much screen contact and less eye contact. So that's just the way it is. So I think now what we're trying to do is, and we know that we absolutely need technology to help us in what we're doing and take away some of this burden from the EHR, because it can be done. It can be pre-populated. Somebody else can do this. Somebody else can find out. We can also see the right patients at the right place. The problem is, unless you work collaboratively, and I think we've done that many in this last instance, we've sort of worked with Medictor about, come and see what we have. Boots on the ground. I'm not going to tell you about it. Come to my office. Come to Peter's office. Go to a walk-in center. Get to know the difficulties, feel there, spend a few hours, talk to the people, ask them what their pain points are. Mm-hmm. Take your notes home, and you talk. Then you look at your own product and you say, this is going to make those pain points worse. Or we could tweak this and get rid of those pain points. And then you come back, and then you should test it in sites where there are champions, because if you've got naysayers, it's going to fail. And then once you test it and you get the go-ahead, you use those champions to tell their peers what to do. Not the leaders, not the innovators, not the vendors.
So I was going to ask you guys, and this sounds like a part of the answer, but I do want to bring it back to get your input as well. So it almost, I mean, I feel like the element of trust that exists between technologists and clinicians has just, EMR hurt that pretty badly. And how do we rebuild that? I mean, is it part of this, like finding that champion who is in the hospital system, who can then kind of bridge that gap, almost as like a translator between the tech company or the startup and the rest of the team that's working, delivering clinical care? Or are there other ways that because I think that's the thing, is that this new generation of startups doesn't really, a lot of them are not familiar with what happened with EMR, but they're bearing the brunt of the bias then that's coming at them. And so what would your advice be, I guess, to those guys in terms of like, how do you this is a fight that you didn't start, but here you are at the tail end of it. And so how do you rebuild trust with the health system in order to better, I guess, expedite the uptake of innovation so everybody feels comfortable, the risks are mitigated, the quality is there? How do you do that? How do you rebuild that trust?
So I don't want to say trust. I just think there's a reservation. There's fear. There's an uncertainty. So look at this meeting, and I think Oscar from Medictor mentioned this today. How many physicians are in the audience? It's the majority, if not more than the majority, is all innovators, and so we have to change the culture. And so how do you change the culture? So I think the Barcelona Health Hub has to reach out to the universities, create partnerships, and do things in joint. We're doing the same thing. We created the Center for Healthcare Innovation at Yale New Haven Health System that's going to leverage the university, but really create a culture of innovation so that it can come from anywhere within the health system. We do that, and we start by having hackathons, pitch events. So you basically create a mixing event of these different entities, everyone coming together. They learn about each other, there's communication, there's understanding, and then hopefully there's joint collaboration. So to me, the answer is we have to change the culture, and I think this is a perfect example. I said Barcelona Health Hub. Next year, this should be Barcelona Health Hub, symposium / some hospital that's jointly doing this together. So you actually bring the physicians, health IT individuals working together so that there's better communication between the two.
Actually, Yale New Haven Health System might be in on that.
So I think the other question with the innovators is the following. Are they paying attention to the different groups of generations of the users? There are, millennials physicians, there are mid-age physicians, and there are late age physicians. All of them continue to provide care. We have the same subsets of patients. So when you develop a product and you launch a product, are you paying attention that the users are going to be all three. And quite frankly, the senior people might be the one to reject it first. Not because the product is bad, but it was so designed by generally very young people who a lot of stuff is intuitive. You know, my son, my children could never tell me what to do, but they could do it on any system.
Right.
But if I asked them, tell me how this happened, I don't know, Dad, it just
works.
happens. So I think, and I'm amazed actually about the iPhone. I think it's a pretty neat innovation, but it catches all generations. But there are a certain generation, for example, that use it every application in there. And then there's maybe the 65-plus-year-old guys who reads his email and looks up, his things and maybe some YouTube and has 5 functions. But you independently can access those functions and don't need to know about everything else. So I think that was a good example that somebody paid attention to who the buyers and users were going to be, and everybody can, even a 4-year-old can, unfortunately.
Yeah.
I just add one other thing. So I was just going to say that I think that innovators and physician innovators, everyone should be mission driven. And I think people are, I've seen it in Barcelona, the little subheadings of, this is for patient experience, this is for, so if you think about it, and one of the things that we think at Yale New Haven Health System is that value is basically it's a product of patient experience, quality, safety, divided by cost and price. So, what you want to do is we want to work on things that are increasing quality, increasing safety, increasing patient experience, and decreasing cost. But one of the things that we're missing is physician experience, physician engagement. So I think it's a new area. You've already pointed this out. And so we need to start thinking about how do we improve the physician engagement or interaction with their patients. And I think that's going to be a new area that's going to be evolving. So it's not just patients now, it's patient/provider. I should say the word provider because I think it's more correct than saying physician experience. And I think that's what we need to do. And these are the themes that we have to kind of focus in on.
I think that's a great point. Did you have anything you want to add to that?
No, I think we've covered it. I think we've covered the fact that our focus should be, to summarize, the patients, the providers, and the experience has to be enhanced. And the only way we can get there is if we have a collaborative movement with the innovators.
Well, this is a great start here, isn't it? Awesome. Thanks so much, guys. It's a pleasure to speak with you. I'm Jessica DeMassa with WTF Health. Thanks so much for joining us.